Welcome to Dr. Balga's podcast for the Curious Doc. Today is 29 December 2025. This video is on a Science Translational Medicine article published 5 days ago on 24 December 2025, titled Reconnecting the Vagus Nerve to the Heart through Nerve Conduit Preserves Cardiac Function in a Minipig Model of Right Cardiac Vagotomy. The vagus nerve and the heart connection. The right vagus nerve is a key parasympathetic regulator of cardiac homeostasis. Its injury during cardiothoracic surgery or cardiac transplantation leads to adverse remodeling. The objective of the study is to test whether early reconnection of the right vagus nerve preserves cardiac structure and function. The model was an adult male Gottingen minipigs with right vagus nerve anatomy similar to humans. The groups included sham controls 5, right vagus nerve vagotomy untreated 7, right vagus nerve vagotomy plus chitosan polyepsilon caprolactone nerve guidance conduit, which causes reconnection of the right vagus nerve. Follow-up 10 months, 1 month and 4 months. Assessments: cardiac MRI for strain and volumes, invasive hemodynamics, Holter heart rate variability, histology, immunohistochemistry and quantitative proteomics. Statistics: two-way analysis of variance with 2 key post-hoc testing. What did they find? LV function. Untreated animals showed progressive decline in global longitudinal, circumferential and radial strain by 4 months. Treated animals preserved near normal strain. Synchrony. Untreated minipigs developed interventricular diastolic dyssynchrony or septal bounce, absent with right vagus nerve reconnection, p-value less than 0.01. Remodeling. Right vagus nerve repair reduced fibrosis, cardiomyocyte hypertrophy, oxidative stress and macrophage infiltration. Innovation: partial, about 20% preservation of the viable vagal fascicles were sufficient to restore myocardial parasympathetic and sympathetic fibers. Molecular: proteomics showed normalization of mitochondrial respiration, calcium handling, and suppression of senescence pathways. Limitations of the study: this is a male-only animal model. The follow-up period was only 4 months. And incomplete re-innovation. It was not total re-innovation. Long-term durability and female applicability remains unknown. Clinical pearls: even partial restoration of vagal input can meaningfully preserve ventricular mechanics. Cardiac dysfunction after vagotomy is driven by autonomic imbalance rather than hemodynamic load. Loss of parasympathetic tone accelerates oxidative stress, inflammation, and myocardial senescence. Right vagus nerve targeted repair may be relevant after cardiothoracic surgery, heart-lung transplantation, or cardiac transplantation. Strain imaging detects subclinical dysfunction earlier than ejection fraction. Key concepts and eponyms. Hit pause and read at your own leisure. These are relevant to this article. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.